Without further ado, it is my pleasure to introduce Ann Pizzacalla of the Hamilton Council on Aging and Francis Lester, a retired physician who will be leading today's session. Thank you, Ann and Francis.
And good morning, everyone. Thank you, Chris, for your introduction and for helping us with this session. As was mentioned by Chris in the introduction, this series is prepared by GERAS and the Hamilton Council on Aging. And today we will talk about things we might expect as we age, as an introduction to a series, 5 more sessions, on ways that we can age in better health, make our aging more positive, as Chris said at the beginning. Next slide, please. And again, we'd acknowledge the fact that this series was initially prepared by GERAS and McMaster University, and also the Hamilton Council on Aging input. People responsible for the development are listed here. Next slide, please. Next slide. So we are all aware that a larger proportion of the population is in the older age range. In the last few decades, life expectancy has been increasing. The information before you at the moment is published in 2011, but it reminds us that at that time, about 16% of the population in Canada, similarly in Hamilton, were over the age of 65. Canadians are living longer. Life expectancy at birth for men, calculated around the same time as the statistics above, was 78 years, and for women about 83. If persons reach the age of 65, they have an average chance of living another 18 years if men or 21 if women. That is into the mid-80s. So what we want to talk about in this series is how to make as many of those years as healthy as possible, as long as possible. Next slide, please. So what happens to our cardiovascular system as we age? Heart rate may be slightly slower and the heart may be a little bigger, and in particular blood vessels get stiffer as we grow older. Now, does that matter? Well, they become less flexible, and this is one of the reasons, I'm sure you have all heard, that for example in heat waves such as we are experiencing now, the elderly are more likely to become dehydrated than younger persons. It's because the cardiovascular system doesn't adjust as quickly to volume changes produced, for example, by profuse sweating. The same applies to volume changes that might occur with an acute illness like diarrhea and vomiting. So the risk of dehydration is higher. The risk of dizziness on standing is higher. And most people know that there's advice given to get up slowly from a lying position if you have to answer the phone or go to the bathroom. Again, because it takes a little longer for our system, our blood pressure, to adjust to the rapid change in posture, and that's normal with aging. But not normal is that blood pressure may be higher because of those factors and therefore should be followed. Next slide, please. Is there anything we can do to help maintain maximum health of our cardiovascular system into old age? Diet will be discussed next week in the session on nutrition. Very important, particularly avoiding fats of animal origin and maintaining a healthy weight. Exercise also important, and in this series will be discussed in the third talk. Smoking is really bad for people's arteries and should be never started if possible, and if it's started, it should be stopped. Easier said than done to avoid stress, and it's important to remember that sleep is a huge factor in maintaining health as we grow older. Next slide, please. Looking at our eyes is a very important sense of vision. In normal aging, the tear glands become a little less efficient and the eyes may be drier. The lens may change in color a little bit yellow, thus making it harder to sort out the purple from black from navy blue, for example. And as most of us of this age group quickly recognize, we become more sensitive to glare. Next slide, please. These changes are partly because it takes longer for the aging eye to adjust to rapid changes in lighting. So that rapid change from a dark highway to the oncoming bright headlights is slower in the older person than it is in the young. And it is one of the problems that makes night driving or night driving in rain more difficult, and it is a normal part of aging, happening at a different rate in different people, at a different time in different people, but very common. Also, we all know that most people need reading glasses in the latter decades. And again, because adjustment to changes in focal length from that distant object to your book is more slow than it once was. Most adults who are over 60 need 3 times as much light to read as a 20-year-old. And that's an important factor to remember. Next slide, please. So what is not a part of normal aging is very important. So I've mentioned what you might expect and what you learn to deal with, but if you should contact your eye care specialist if you have sudden loss of vision or sudden extreme blurring, if you see rapid flashes of light, if you have eye pain, experience double vision, seeing 2 things instead of 1, and if there is redness or swelling of the eye. None of that is normal at any age, and one should look for medical help with those issues. Next slide, please. There are things we can do to help maintain our vision as long as possible into our older years. So regular eye checks to make sure the glasses are giving us the right focus. Watch for the lighting situation. Try to navigate in the dim areas. Eye drops are helpful. Those are what are called artificial tears for dryness. And eye protection in sunlight or places where there might be flying objects, also very important. Regarding the whole question of driving, that's another subject altogether, but there is useful information under the Canadian Automobile Association and other sources. So next slide, please. The Canadian National Institute for the Blind is a very useful source of education, information on problems with vision. To be noted, you do not have to be blind to access their services. People with various types of visual difficulties can receive very effective help from that organization. The phone call on the slide is accurate, and during the COVID crisis, they are providing various educational services by telephone. So that is an organization to remember. Next page, please. Next slide. A hearing, another extraordinarily important sense. It may be harder to hear in noisy areas as the decades pass. It certainly is a recognized change with aging that the ability to distinguish high-pitched sounds or even hear them becomes much more inactive, much more difficult. So those very high-pitched notes you may miss. Voices may sound mumbled, but that is not normal. And we need to recognize that hearing is extraordinarily important, not just in and of itself, which is true, but very important socially. So the person whose hearing is deteriorating may stay at home because they're embarrassed that they don't understand conversations, they become socially isolated, they may end up with a lot of household friction with a spouse or a family because things are misunderstood or not heard at all. These are very important issues, and you know, if you find that you're complaining that everyone you know mumbles, then you should think again. Maybe the problem is in yourself, and you need your hearing checked. And by the time people are 75 or 80, a very large proportion do have some decrease in hearing and may need assistance, such as hearing aids. The other point to remember, which is so important, is that sometimes being unable to hear might mean that others in one's social circle think the person has a cognitive problem, excuse me, has an early dementia possibly because they aren't understanding, when the issue is their hearing. So it is very important to have regular checkups of hearing. And no one wants to use them, of course. No one wants to admit that they need them. But if they need them, they need them. And hearing aids should be used. Next slide, please. And again, there is a Canadian Hearing Society which can help to provide information also about products which help with improving hearing and how hearing health should be cared for. The number is given in that slide, and hearing should be checked on a regular basis certainly after the age of 65 or 70. Next slide, please. Teeth are also pretty important, and again, it's much easier to chew with your own teeth, and it improves self-confidence and socializing to know that your teeth are healthy and your mouth is healthy, breath is healthy. But it's not just that. It is that infections in the mouth, for example in the gums, can also aggravate systemic diseases. For example, you have chronic infection in the mouth, it can put diabetes out of control. And also it is well known that poor oral or mouth health definitely increases the risk of pneumonia. So there are even whole body reasons for maintaining one's teeth. Plaque may be more of a problem as we age, because saliva, just like tears, is not quite as voluminous as it was in youth, and sometimes people are on medications that might aggravate that problem. So maintenance of dental care is very important. Dental health, I should have said. Next slide, please. And I'm just showing you an example of the kind of infection around the tooth, which is very painful, not very attractive, interferes with eating, but also is not good for the rest of you in terms of systemic illness as well. Next paragraph, please. Next slide, please. Next slide, please. So again, there are community resources to help. We do know that dentistry is dental appointments and dental care are not cheap and may be a challenge for many people, but there are various services that can give advice and can help, and these are emphasized on this slide in front of you. Telephone numbers and addresses being up to date and can be contacted during COVID-19 in addition to at other times. Next paragraph, please. Next slide, please. Okay. One thing that worries so many of us as we grow older is whether we will maintain our memory, our ability to function mentally, what is generally termed cognition. It's made up of so many different factors. Whether or not we pay attention to the world around us, whether we have insight into the significance of what happens, whether we are able to organize as usual and process information, involves problem solving. And memory, of course, involves many different aspects. There is the recent memory, for example, what did I have for breakfast? There's the long-term memory, I'm able to talk in detail about what happened 1 year in high school, for example. There's the memory, the cued memory, that sometimes remembering the place or the circumstances in which one learns something can then set one off to be able to do that performance, that task. And there is a huge reserve of memory of learned tasks, simple and complicated. All of them interconnected in various, very intricate ways. And concern it exists in many people. As I said, what happens is happening to their memory. Next slide, please. So there are certain changes that many of us note. Word finding might be slower. Detailed memory of recent events might find a little off, or more difficulty in doing a couple of things at a time, multitasking, a little more hard to manage than 20, 30 years ago. Some things improve. It's said that vocabulary often improves after the age of 65. What we call cued memory may improve. In other words, if there's some particular object or some particular event comes up, I can suddenly remember everything associated with it, as opposed to just pulling it out of the ether, so to speak. All of these changes can occur with aging, either younger age in some people, older age in others, and at different rates, but they are not dementia. This is very important to remember. They are not dementia. And there will be a more detailed discussion of cognition as individuals age and of the issue of dementia in one of the series, one of the talks in this series after 3 or 4 weeks. So that will be covered in more detail, but the points I have mentioned do not indicate dementia. Next slide, please. So what can we do to stay mentally fit, to keep our brains as active as possible for as long as possible as we go into the senior years? Well, one thing is to learn things which are new or unusual for us. An example might be to try a musical instrument, and even at an elementary level, that one has never tried before. Or do something like join a choir and learn to read music that way, if one has never done it. Learn a new language. Things that are quite different for you in particular will help to maintain mental fitness much more than just practicing something you've always done. Maintaining social contact is very important. Socialization with other people, however, it can be arranged. Not easy at the present time, but it is very important in maintaining cognitive function, that sort of interaction. Sleep and a healthy diet, we've mentioned already in other contexts, and challenging activities which are also what we call multimodal are useful in maintaining mental fitness. By that I mean activities which involve more than one system at a time. An example is dancing, where you have to listen to the music, recognize the rhythm, listen to the person calling the steps, translate the call and the music into what you do with your feet and your arms and other bits of you, and do it at the right time. In other words, you're using motor skills, you're using rhythm and music skills, you're using interpretation skills and understanding the instructions. That kind of activity is helpful in maintaining mental fitness. Another example might be Tai Chi, where again you have to follow instructions to do various movements. So we will take a little break here for questions and then come back to one or two other things to be raised within this session, in which we're trying to point out some of the things that we might expect to see as normal as we pass into our 70s and 80s and maybe even 90s. I'll turn it over to you, Chris.
All right, thanks, Frances. Two questions. So you've mentioned dancing as an excellent example of a multimodal form of engagement to keep the brain active. Are there any other common activities that people can do that would also help?
Well, I did mention also some of the exercise types like Tai Chi. That's one. I mean, even in, say, playing a musical instrument is another one, because it involves physical activity. It involves interpreting that to a piece of music in front of you, and understanding how it translates into the movements on whatever instrument it is. Those are the things that come immediately to mind, but there are many various exercise programs in which one has to follow somebody's instructions, also multimodal in a sense. Those are the ones I can think of offhand.
Okay. That's interesting. There's also, it seems like there's kind of a trend towards picking up the ukulele. I've noticed my 92-year-old grandfather recently learned to play, and so it's keeping him busy and happy during this time. So that's not too challenging an instrument to learn, come to think of it. Thanks.
Great.
The other question. Oh, sorry. Did you have something yet?
I was just going to say, what I've heard the activities classified as is that it should feel a little bit hard. It should require some effort on our part, and actually learning all the new technological learning that we're doing these days. I'm hoping that counts as well.
Yes, that's a very
does
good
feel like it.
That is a challenge. Activates bits of our brain that have been not doing much, so to speak.
So the other question, some people I know can experience, this goes to hearing, can often experience like just a persistent ringing or frequency in their ears. Is that something that can be treated if they, or do you have any general advice about something like that?
I think there are different causes of ringing in the ears, and it can be a huge nuisance. It's not always associated with loss of hearing, but it might be. And I think that if someone has ringing in the ears, they should have a complete otological examination to determine what frequencies they're not hearing, in what way their tinnitus is, that's the term for it, tinnitus is interfering with their hearing, and try to identify what the cause is, some of which might be able to be mitigated. Sometimes it is very difficult to get rid of with some disorders. Some people find that if it interferes with sleep, if they use some sort of what we often call white noise in the background, that might help. But the important point is to go to a hearing professional, have the hearing professionally examined, and try to determine what that person's cause for the ringing is, and is it one that anything can be done about.
Perfect. Thank you. No further questions at this time.
So we'll just go on with the next slide, if we might.
Sorry, it's just loading. 1 second.
Okay. So we've mentioned sleep once or twice, And sleep deprivation is a problem. We really require adequate sleep to maintain cognition, the most efficient mental function possible. And it's very important, as I mentioned earlier, for cardiovascular health, our health in general. Persons who are chronically insomniac or sleep deprived, their cognitive performance is affected. They may be more irritable. In some people, it increases appetite, which is not a good thing if you have diabetes or are on the heavy side. It's very necessary, not a luxury, it's a necessity. So what happens? Next slide, please, Chris. What might happen to give us trouble with sleep as we grow older? We tend to sleep less efficiently, maybe wake up a little more. And that's particularly true as most people past a certain age do have to get up to the washroom at night, which interrupts sleep. Also, there may be pain or soreness related to arthritic complaints or other chronic medical issues. And of course, we are often caregivers for a loved one who may need help during the night. All of this it can interrupt sleep. Next slide, please. But again, as I say, it is of paramount importance to have adequate sleep in terms of improving daytime function. Seems obvious, but we tend to forget it. So what can we do? Well, one is, as mentioned here, bed is for sleeping. It's not for watching active television programs, for example. It's important to try to sleep on a regular schedule. We should be exercising, but often if we do it just before going to bed, it may make it difficult to fall asleep. So exercise earlier in the day is a good idea. Avoiding caffeine after, some people say after the early afternoon, will help with sleep problems. Caffeine does keep a lot of people awake. We have individual susceptibilities, of course. Some people cannot tolerate 1 cup, and some people can drink gallons and doesn't seem to bother them. Alcohol is often used to help go to sleep, but it isn't helpful in the long run, in the sense that people generally wake up in the night because of the alcohol having been metabolized, the bladder effects, etc. So alcohol is not a good sleep-inducing solution. If a person is awake for any length of time, it's better to get up and do something quiet around the house and then go back to bed, rather than lying there thinking, I can't go to sleep, why can't I go to sleep, I'm still awake, which doesn't help. And when a person wakes up in the morning, to actually get up. I will mention here a caution with sleeping medications. Sleeping medications are very useful in certain circumstances, maybe when there's pain of an acute illness, for example, or when there's an acute reason that hopefully pass for having difficulty sleeping. They're very, very useful, but to be used every night on a long-term basis is, on the whole, probably not a good idea, particularly for the elderly. They may interact with other medications. They may cause more drowsiness in the morning than you expect. They may aggravate things like dizziness on standing when someone has to get up in the night. So those medications should be reviewed in the context of all other medications with your healthcare provider. Next slide, please. And bladder changes with age. Now, that's something that is very often not discussed. It's really quite important. The bladder capacity, as the amount of urine it can hold, tends to decrease, and with older age, sometimes the urge to pass urine doesn't give very much time compared to what it did once when we were younger. Pelvic floor muscles may be weaker for all sorts of reasons, either repeated childbirth or just because muscles in general are not as strong as they once were. Men have often a problem with prostate enlargement, which results in frequent urination and having to get up at night. And for reasons that are not well understood, the urine output at night may be as much or more than during the day in old age compared to youth. Next slide, please. So the information on this slide is sounds a bit startling. As I mentioned, 52% of Canadians have reported in that particular study a problem with accidental urine loss. This covers all the different types of intermittent or occasional as well as chronic urine loss. So it needs to be interpreted in that light because there are many different problems. Some are frequently getting up at night, some are related to having to go very often, or what I mentioned already, what's called stress or urge incontinence, which can happen with coughing or laughing or activity. Now, this is important in that we need to recognize that such issues are not a normal part of aging. They are issues that very often, in fact, can be treated, and if not completely cured, at least made a lot better, and therefore should be reported to a healthcare provider. The sad thing that one reads in studies such as the one mentioned on this slide is that not more than a quarter of people who might say they have had such problems have reported it even to a family physician. So they keep it to themselves, they're embarrassed, and it contributes to social isolation in the sense that they're afraid to go out because there might be an accident or they might not be able to find that washroom in the department store or whatever. So it's a problem beyond its immediate discomfort, and it should be raised with one's healthcare provider. For example, prostate problems in men can be treated, and very often the frequency, nocturia, and so forth markedly improve. Urinary tract infections, which can cause a lot of difficulty with frequency or not having enough time to get to the washroom, can be treated. So again, incontinence is not part of normal aging. Certain difficulties with the bladder, like getting up at night, are, but losing control is, even in small ways, is not and should be reported and dealt with. Next slide, please. And the next slide, please. There are clinics in Hamilton. There is a clinic particularly dedicated to this issue, and the person can refer themselves. You don't even have to be referred through your healthcare provider. Information is given on this slide. So the next slide and the last topic we'll discuss this morning is the whole issue of bones and strength and balance, which are interrelated. So bones and muscle, surprisingly, start to decrease in mass and strength when we're in our 30s. But by the time we're in the older decades, certainly there can have been marked loss, particularly if we've not paid attention to maintaining those functions. Bones become more fragile, more easily fractured. This is particularly true in the years immediately after the menopause in women. Similarly, men after the age of 65 may have increasing difficulties with bone strength. Also, cartilage becomes limited. The cartilage that covers joints, which means there's more likely to be some joint discomfort. Begin to have osteoarthritic complaints because of those kind of changes, and that also might decrease mobility and contribute to decreased strength. And many people have, for different reasons, medical or otherwise, more problems with balance, maybe even because they're not as strong as they were. Next slide, please. So that change, that loss of strength and the loss of muscle mass, which is a gradual thing and which most of us don't really notice until it's, several years have gone by, is very important in increasing the risk of falls. It also increases the stress on our joints because the strength of the muscles supporting the joints is not as good as it once was. The next slide, please. So, prevention of falls is an extremely important thing to consider at all ages, but particularly in old age. And we shall have a session within this series to discuss particulars of fall prevention and accident prevention. But in this particular session, let's just remember that falls can result in minor fractures, but they can also result in serious fractures. The worst being fractures of the hip or of the vertebral column, or of course head injuries. And such falls are often the event which precipitates loss of independence for the older person. The surgery required or the recovery time required, the rehabilitation is not easy, and the consequences of hip fractures can be quite devastating. So prevention is really important. So looking at certain prevention strategies, adequate doses of calcium, which is something one should discuss with one's healthcare provider. Vitamin D replacement. Remember, we live in northern latitudes and sunshine's not very effective a large part of the year. That's very important. Some people who have diagnosed osteoporosis might need particular medications. That's again a particular medical problem. But to come back to some of the points we've mentioned in earlier parts of this talk, exercise which includes improving balance, exercise to improve muscle strength, is really important even into the 80s and older. It's been shown that people who are putting gentle exercise programs at advanced age will have less risk of falling if they've improved their muscle strength. So it's always worth trying, and prevention of falls is, as I said, of paramount importance in maintaining independence and maximum health into the older decades of life. Next slide, please. In relation to that, mentioned on this slide are some resources that you can access to help you with this question, particularly the Osteoporosis Society of Canada, and also various exercise programs at places like the Y and the recreation centers. It's mentioned on here that you must always review your medications with your family physician on a regular basis. That sounds a little bit strange in relation to falls, but remember that sometimes things like blood pressure medications, which were once necessary, maybe aren't necessary any longer, and having lower blood pressure might contribute to falls. So, or medications might not agree with each other, so to speak, might have interactions. So regular medication review, particularly if you're on several, is very important. It can be done with the family physician or can be done with the pharmacist. I think we'll stop here for this morning. I have a few minutes for any questions which may have come up. Thank you very much for Chris for helping with those slides and for being a host this morning. Thank you for Anne for attending and listening. And are there any further questions before we terminate this session?
I have two questions that came through on the chat here. Well, actually, one is from me. When I think forward to retirement, I often kind of imagine napping a lot. So I was a little disappointed to hear that we should limit naps. When you say that, do you mean just kind of like napping frequently? Like, there's surely some benefit to napping, to occasional naps during the day, right?
Oh, definitely. There's certainly a benefit if one is particularly tired or one has been doing a particularly demanding activity. But I think that is mentioned because if you're having frequent naps that are longer than naps, when one is sleeping quite a bit in the daytime, that's obviously going to interfere with nighttime sleep. Now, that's a personal preference. If you would rather have, naps in the day and sleep short at night, and recognize that that's the reason you're not sleeping at night, I guess that's fine, if you see what I mean.
Yes.
But if you're thinking that, there's the insomnia is a huge problem and forgetting that you spent 2 or 3 hours of sleep in the day, then, you're forgetting that in fact was part of your 24-hour sleep, if you know what I mean.
Yes.
So that's why it's mentioned there. Of course, the occasional nap is fine.
Yeah.
But
okay.
Not to blame, not to forget that is part of your daily sleep, in a sense, if you're having long sleeps in the day.
Thank you. Okay, and another question has come through. Hello, Francis. I've heard that some physiotherapists offer some form of pelvic floor rehab. Does this work?
Yes, it works for some people. It depends, of course, on the cause of your problem. So if the cause of the problem with urinary control is weakness of the pelvic floor, which is fairly common, particularly in women who've had multiple children, in other circumstances, those exercises that can be taught by a physiotherapist or a clinic, as we mentioned, which focuses on the problems of urinary control, can definitely help. Of course, before embarking on them, one would want to be sure the person doesn't have some other treatable situation, like, for example, chronic urinary infections, which will mean that doing pelvic floor exercises might not help. But they do help quite a lot of people. And that continence clinic that was mentioned on the slide a few slides back could give advice in respect to that as well.
Great, thank you. And one last question. So I think there's a lot out there about the role of vitamin D and its importance right now. And understanding that you do recommend that people talk to their doctors about levels. Are there some? What are the best ways to work some more vitamin D into the diet, particularly in winter months?
Yes, that's a good question. So through the winter months, obviously we do not get enough sunshine at the right angle or the right ultraviolet rays to change the precursor of vitamin D in our skin into vitamin D, which is an amazingly efficient system if we are getting enough of that kind of light. But at this latitude, for many months we don't. It is difficult to get enough vitamin D in the diet, although milk is fortified, as you know, with vitamin D in various animal products. But to get enough from the diet is difficult with vitamin D. And I think the current recommendation for older adults is around 800 to 1,000 units replacement, particularly in the winter months. I could stand corrected on that. But it is quite important, and the recommendations are that that is one of the supplements which is definitely required at this latitude. There's a lot of other supplements that will be advertised in various ways, and which we'll mention in the nutritional session, don't have nearly so much support for their necessity.
Great. There are no further questions right now. So thank you so much, Francis. That was a wonderful overview of some of the things that we can expect as we age, and a lot of practical advice on how to deal with those challenges. We really appreciate your time this morning.
You're very welcome, and thank you for helping, as I said. As I said, there will be further sessions at the same time on Thursday and next week's going over some of these issues in more detail. So good.